Following topics will be covered in part 3 of the lecture on management techniques in healthcare. Management techniques mostly used in healthcare can be classified as qualitative, that is those which are based on the organizational behavior, organizational design, personal management, communication, information systems, management by objectives. These have been covered in part 1 of the lecture. Then quantitative, which are based on health economics, cost benefit analysis, cost effective analysis, cost accounting, and input output analysis. These have been covered in part 2 of the lecture. Other quantitatives are those which are based on budgeting and operational research. These are model, system analysis, network analysis including PERT and CPM, planning, programming, budgeting system, work sampling, and decision taking. These are covered in this lecture, the part 3. Model. A mathematical model of the program is constructed by studying the effects of different inputs on the outcome. That is, the model which is constructed shows the interrelationship among various inputs, which can be increase or decrease in the number of workers, increase in the cost input, increase in time input, and its effect on the output, which may be number of lives saved, number of vaccinations given, number of patients cured, number of health personnel who are trained, etc. The mathematical model is similar to a mathematical equation. The increase or decrease in any of the input results in some change on the output. The change in output is not straightforward. It is not the same in all the settings. It will depend upon the interplay of many inputs and other factors which are unique in a given setting. So the model or equation is constructed using previous data which shows the impact of various risk factors and interventions, the effect on the output. And these observations are used to construct the mathematical equation which is unique to the situation. So, if we do not have these observations already, we cannot construct the model. A hypothetical example is shown. An equation is there which shows the net profit per 1,000 rupees spent on the clinic. The equation shows in green various variables. If you change the variables, there will be the net profit would change on the left side, that you can see, calculate. In actuality, this is a very simple equation. There are more extensive equations actually built into a software. These softwares can be installed into the computer, and the effect of altering one or more inputs can be directly calculated by the software. The change in input can be like increasing the number of trainers to double, add additional 500 sites for cancer screening across the state, etc. The software will predict the increase in the number of lives saved from the carcinoma cervix for each of the above change in input. Systems analysis. The technique is used mainly for increasing the cost effectiveness of a program or institution or any system. The basis of systems analysis is that any system is made up of a number of subsystems. If each of the subsystems is analyzed using a number of strategies and the most cost-effective strategy is adopted for each subsystem, then the whole system automatically becomes cost-effective. So the basis is that the program, institution or system is viewed as a number of subsystems working together to achieve a common goal. Various subsystems, they form the main institution or the system. If each subsystem is independently studied and modified to achieve maximum effectiveness, then the effectiveness of the whole system will automatically improve. Moreover, the interactions among subsystems can be analyzed further and modified for further effectiveness. A hypothetical example of system analysis is given. A hospital is to be made more cost effective. Hence, all the systems are to be analyzed one by one. One such system was chosen as medication system. The boundaries of the systems has to be fixed. The beginning of the system is when the physicians, they put in the drug orders in the patient's file after their morning round, and the ending of the system was determined to be giving off over by the night shift nurses to the next morning shift nurses before the morning round begins again. The steps within the system were identified as noting down the medication orders from the patient's files into the drug register, checking the inventory for availability of drugs, ordering the unavailable drugs from the hospital pharmacy, beginning of the morning medication round, all the steps within the medication round, then giving over to afternoon shift nurses, followed by patient's note which are put in by the physicians in the evening round, and again the steps for beginning the evening round and the evening round steps. Finally, giving the over to the morning shift nurses before the next morning round begins will end the system. Various administrative, environmental and legal factors which influence the system were noted, like what are the policy of the hospital, what are the laws of the local area, the lighting, the environmental factors of the ward, the lighting, ventilation, etc. So all the factors can influence all the steps are noted down. Then data is collected to study the current cost effectiveness under the given conditions. Various changes in the factors etc. are suggested to improve the cost effectiveness of the system, and all the strategies that have been suggested are virtually fitted into the system that was made on paper, and cost effectiveness is worked out for each of them. And then the most cost effective strategy is identified and trials are carried out and finally is implemented. In a similar manner, all the other systems which comprise the hospital are identified and analyzed one by one. Network analysis is useful for a new project. Example of projects are: a rural health center decides to establish a nutritional counseling clinic for under 5 children, or hospital decides to develop a program to reduce cross infection, or the health ministry is to launch an MCH program. Characteristics of a new project are that it has a unique purpose. For example, establishment of a nutritional counseling clinic or launching of the MCH program. It is temporary in nature, that is, once the objective is achieved, that the counseling clinic has been set or MCH program has been launched, the project finishes. Requires resources and involves uncertainty. It is yet to happen in future and hence involves uncertainty. So what is network analysis? A project requires a large number of interrelated activities for completion, and the orderly accomplishment of this large number of tasks of diverse nature is important. So network analysis breaks down a complex project into its component parts and plots them graphically to show their interdependencies and interrelationships. The lines which connect the events are called paths. So the basic principle of network analysis is to show diagrammatically the logical sequence in which different events will take place between the start and the end of a project. A network model consists of a set of points which are shown as circles or squares, and these points are joined by lines. The points represent accomplishment of a task within the project. The connecting lines represent the activities which were undertaken to achieve this task. Once the graphical map is there, any delay across the network can then be anticipated and corrective action can be planned well in time. An example is given for network analysis of the project to launch the program Eradication of Disease X. First step, it is decided to eradicate the disease, and the decision was formally signed by the competent authority in 7 days. After the decision is formally signed, the demands can be placed for vaccines. Simultaneously, vaccination training can begin for medical workers, which will take 15 days to begin the training. And simultaneously, the demand can be sent for the medicines for treating the disease. Also, simultaneously, efforts can be launched to begin the training of medical officers and private practitioners within the area for treating the disease X as per the government protocol. Beginning of this training will take 15 days approximately. Also, simultaneously, efforts are started to establish surveillance for detecting the cases which will be treated by these trained doctors subsequently, and 1 month is required to establish the surveillance system in place. Now, the vaccines would be received approximately within 6 months of the demands, and the training for medical workers would take 6 months. So simultaneously they will get completed, and within 1 month of receiving vaccines and within a few days, the vaccination can begin in some districts. The medicines would be received in approximately 3 months from the demand sending, and the training of medical officers and private practitioners would be completed in approximately 3 months. They would be trained to treat the disease X as per the government protocol. So once the medicines are received, within 1 month of that and within 15 days of training all the doctors in the area, the treatment of the disease can begin in the local clinics and hospitals. And the cases which will be treated would come from the surveillance that was established. The surveillance will detect cases which will then be referred for treatment to these doctors. And within 12 months of vaccination in the district, all districts will be covered in the area. Similarly, the treatment as per the government protocol within 12 months will begin in all the districts. And this marks the end of the project and beginning of the program Eradication of Disease X. PERT and CPM are two variations of network analysis which are mostly used in healthcare. PERT is Program Evaluation and Review Technique. It is useful mainly for projects which are new in nature, do not have much precedence, and hence the likely steps and the time and cost needed for each step is only based on estimations. That is, the whole network is based only on estimations. Whereas critical path method or CPM is used mainly in projects which have been repeated enough and at many places, and hence the likely time required for each activity is precisely known. The purpose of critical path method is to identify the longest path in the project and apply methods to shorten this path so as to finish the project at the earliest possible time. Project Evaluation and Review Technique. Useful mainly for new projects which are mainly new and have no precedence. An example, a project to launch program for eradication of disease X, already been discussed. And the network map that is made, it allows an estimation of the time and money and other resources which would be needed to complete the project. It allows prediction of likely delays and hurdles that can come in the map, and these delays can be addressed beforehand on the map itself and by taking appropriate administrative actions in anticipation. Hence, PERT is a scheduling tool. That is, how will each task will be completed, and if some tasks can run in parallel or some need to run only in series, and a schedule is formed by altering the map a number of times and helps in finding the best way but not the shortest way to complete the project, and estimation of the time that the new project will take, because this has never done before, and the estimation of the cost and other resources also, because again there is no previous experience. An example has already been discussed in the project to start a program for eradication of disease X. As a practice in PERT, try organizing the cooking for a party in such a manner that all the items of the menu are ready half an hour before the party begins. Critical path method. CPM diagrams show all the activities in the project and the time required for their completion, because the probable time needed for completion of each activity is already known, and how each activity is related to the previous activity and the next activity. A sequence of activities is called a path, and the longest path in the diagram is called the critical path. This critical path determines the total time that will be required for the project. The path is called critical because all activities on it must be completed in the designated time, otherwise the whole project will be delayed. Any delay in paths which are outside the critical path or any speed up in these paths, the total project time will not change. But if the critical path can be shortened, the efficiency of the total project achievement can be improved. As a practice in critical path method, plan the cooking for the next party using the lessons learned from the last party and finding out the critical path. You can then ask your close friends to help you in shortening the critical path. An example of CPM has been given. The project is to set up nutritional counseling at a rural health center. So the map begins with the decision to start the counseling, nutrition counseling, and immediately after the decision, efforts are on to choose the appropriate health workers. It will take 7 days to identify the team. The team can be sent for training, and in probably 3 months they would complete their training. Within 2 days of completion, they can be assessed, and if they pass the exam within 1 day, they can start sitting at the counseling clinic. Immediately with the decision, a team can be sent to identify the premises for the counseling clinic. In 7 days, they can begin their work, and once they identify, they can ready the premise within 30 days of civil work and all. Once the clinic is ready, with all the formalities would be complete in 5 days, and counseling can begin. With the decision to start counseling itself, a team can set on to start preparing the IEC material. IEC material is required to make people of the area aware of the counseling center so that they can bring their children for nutrition counseling. The IEC material would be ready within 15 days approximately, and within 4 days they can start the IEC, the information, education, communication for the villagers. It is estimated that within 30 days the first village will be covered, and then with the experience, next village will take 20 days, then 20 days for village 3, 4, and then the 15 days for village 5, maybe it is small, and next 15 days the last village 6. So within these days the whole area would be knowing about the starting of a counseling clinic, and then within 15 days of finishing with the IEC, the counseling can begin. Now path 1 will take 42 days, path 2 will take 100 days, and path 3 is the longest. It will take 154 days, and hence can be called the critical path of this project. To shorten this path, some people can be withdrawn from the team which is going for identifying the premises, because they can take more than 7 days for identifying the premises, but a second team addition for IEC can cover 2 villages simultaneously, and hence shortening the critical path. These are the differences between PERT and CPM. PERT for new projects, CPM for projects that have enough precedence. PERT is a scheduling tool, and CPM finds the shortest way to complete the project. Time required for each activity on the map of a PERT is only an estimation at the best. The time required for CPM projects, the time required for each step is already known precisely. The main objective of PERT is to complete the project in time-bound manner, whereas in critical path method, the main objective is to complete the project in the shortest possible time. Similarities between PERT and CPM. Both are used for accomplishing new projects. Both consist of graphic representation of the events and activities. In other words, both are types of network analysis, and both help in optimal utilization of time and resources. Planning, programming, budgeting system. In short, PPBS is a management technique where we have already seen that for achieving a goal, we need to undertake first planning, which is then followed by implementation of the plan, and it becomes a program. In this technique, the budget for all the steps of implementation of the program has been specified in the planning stage for only the first year of running. For the next year onwards, once the program is running, the budget for each year, for each step and each component of the program is reassessed every financial year. And the further allocation of the budget for that year would depend upon the performance and utility of each component of the program. So the budget has to be justified. So first planning, followed by programming, followed by budgeting each year is a cost saving management technique and known as planning, programming, budgeting system. Zero budget approach is a form of PPBS. The budget for each component automatically reduces to zero at the beginning of each financial year, unless the amount for that component is justified by the workers, and only that amount which has been justified satisfactorily will be released for that year. Work sampling is the management technique that is used for sampling, for estimation of the utilization of equipment, machines, vehicles and time by health personnel. That is, whether they are being satisfactorily or optimally utilized or not. It involves observation of the workers for the activities carried out by them during the course of routine work. You can see that the manager or his observer is sitting quietly and observing the work which is going on routinely. The observations should be many and not just a few times for having any valid estimates. And the day and time chosen for these observations should be done at random. They should be randomly selected. Each observation should be of sufficient length of time to be of any meaning. Once we have the sufficient number of observations of sufficient length each, they are added up and subjected to statistical methods to obtain the valid estimates of ideal time of machines and equipment, that is the time for which the machines and equipment is lying unused, and utilization of time by the health personnel for various activities. And then, if required, if it is felt that there is a scope for optimization of use of machines, equipment and time, then appropriate modifications can be suggested. An example of work sampling, a hypothetical example has been given. In a large hospital with 10 wards, work sampling was done in each ward. After 12 weeks of long observations, each observer reported that the class 4 worker leaves the ward between 11 am and 12 pm each day for depositing the lab specimens. And then he or she returns after an average of 1 hour 40 minutes. The timing may have been different in different wards, but the average time of coming back returning is 1 hour 40 minutes. And it was observed that the labs were within a distance of 5 minutes and to or fro should not take more than 10 minutes. Hence, a wastage of average 1 hour 30 minutes was reported in each ward. So a decision was taken that one lab personnel would be appointed who will go out every day to collect samples from each ward at 11 am, and that no one shall be asked to leave the ward duty for delivering these samples to the labs on routine basis. This practice was in place and it saved 10 wards into 1 hour 30 minutes, that is 13 hours per day of class 4 workers' time was saved, and this time was utilized productively in patient care, and this resulted in improved patient care and more patient satisfaction. Decision making. This technique is required when there are more than one ways of reaching the goal. Each option is given a value and the possible consequences of each method are listed and again given a value. The probability of each consequence occurring is assessed and the best possible action is decided according to the final score. Like an example, you can take either course A or B, or there's an option to take course C. These are the consequences for course A with a probability of 26%. This consequence has a probability of 50%, 75% chance of occurring. Course B, these are the consequences if you take course B, and this is the probability of their occurrence. Similarly, these are the consequences of course C with their probability of occurrence. Now, it is the role of the analyst to assist in this decision-making program. What does the analyst do? The analyst gives these values which you can see. The analyst calculates the probability of the possible outcomes of each course of action, the figures that you see. This probability of occurrence of the consequences is based on past experience and epidemiological evidence. Let's consider an example of decision taking. A health administrator is required to tackle the situation of increasing antibiotic resistance due to overuse. The following options are available to the administrator, that is option 1 is to hold numerous nationwide training for doctors so that they are trained in proper use of antibiotics. Or option B, bring all the antibiotics under strict government control, and these can be obtained only on a doctor's prescription and also in which the rationale for use of antibiotics is clearly mentioned. We can have the possible outcomes as listed below, and we give the desirability value to each of the outcome. The first possible outcome is that 100% reduction occurs in irrational antibiotic use. This obviously has a value of 100 because this is the most desirable possible outcome. Now the analyst analyzes the previous data and the previous experience and gives the probability of this outcome as just 5%. Just 5% probability of this happening after the trainings. But the probability is 40% after the second option, that is the strict government control is exercised. The second possible outcome is a great reduction, though not 100%, but a reduction of 50 to 70% in unjustified antibiotic use. This change has been given a score of 25, and the probability of this occurring is worked out to be 20% after the trainings, but 60% after strict government control is exercised. The third outcome is that no change occurs. And this obviously has a score of 0 because this is the worst possible outcome. The probability of no change occurring is worked out to be 90% after training. That is, the training render no change. There's a 90% possibility of this happening. But the possibility of this happening after the second option, that is strict government control, is just 50%. So there is still a 50% chance of no change occurring after the strict government control. Now this table lists the possible action on the left hand side and the possible outcomes with their scores on the upper side. We can see that the score of 100, that is a nationwide change, has a 5% chance of occurring after training. So this gives a value of 500. The score of 25 after widespread training is 500, and the possible outcome with the score of 0, that is no change, has a probability of 90%, but the score of 0, so 0 value. If strict control for antibiotics is exercised, then the nationwide change occurrence probability is 40% and the score comes out to be 4000. For a large reduction, not 100%, the score is 25 and the probability is 60. It becomes 1500. When we add up, we can see that the expected value for training doctors about the proper use of antibiotics, the score of outcome is 1000, whereas the expected value for government control as an option is 5500. So this analysis suggests that the most desirable action would be to bring antibiotics under strict government control because the expected value is much larger. There are some preconditions for the technique of decision making, and these are that the decision maker should be aware of all the possible options of achieving the goal. Without the knowledge of all the possible options, you should not go ahead. And also the probability of all the consequences after each option must have been calculated by the analyst before proceeding. And the decision should not be made with incomplete data. So the person who is taking the decision should know about all the options available and the probability of all the consequences occurring after each options before actually going for decision making. And the decisions must be made at the appropriate level, which may not always be the top level. Decision making cannot be done with incomplete data, as this man has an option of going straight or going left and climbing up the tree or going right. Without having a knowledge about the possible outcomes of each path, the man decides to go and climb the tree to save himself. Now see what are the consequences in store. If he had gone straight, there was a dog catcher ahead. He did not have the knowledge of the consequences and their probability.